Hi YouTubers, it's Evan Extra, the Masters of Big SCR. So, usual disclaimers, I'm not a doctor, I'm not giving you medical advice, nor am I a professionally trained person, and nor am I a patient myself. So I don't have this disease or this disorder, this is just general information. So anyway, I want to talk right now HIV testing. So HIV is obviously a virus, a blood-borne virus, and HIV testing is basically the blood test to determine whether or not you have HIV. So it's to determine your HIV status, positive or negative. Now, who should have this test? It's very mixed, the opinion. I mean, some people would say only gay men should have this test, which is completely wrong. I mean, that's complete BS. But it depends. So if you're somebody who is sexually active, a lot of people, actually most people who are sexually active, who are not in a steady relationship, who are going steady, like to be tested every 3 to 6 months. That's a general rule. Some people less frequently, some people never want to be tested, some people never want to know. Now the reason you get tested is because the earlier you catch HIV, the easier it is to treat, because the earlier you get on the medication, the pills, the more it delays the progression of the disease, because the pills help delay the progression of HIV, which turns into AIDS. So there are certain people in high-risk groups that should be tested, and there are some studies that do say that gay and bisexual men should be tested more often than straight people. I personally think that's BS, because HIV can be spread not just through, not going to get too much into it, but you get the point. So HIV is something that's not just limited to gay men. So, and believe me, I'm not by any means prejudiced. So anyway, the bottom line is you should be tested every so often. Really, the only people who should not be tested for HIV, also people who should be tested, not just people who are engaging in sex, but also people who've had blood transfusions. If you've had a blood transfusion recently, you should be tested. Also, if you've had a tattoo where there's needle involvement, you should be tested, because if you're unsure if the tattoo artist was safe, then you should be tested anytime you get really. I mean, I wouldn't get tested every time you get blood drawn, because you're pretty sure when you go to your doctor, nice big ass doctor, that their needles are safe. But anytime you go into some place and it might seem kind of dicey, kind of funky, you might want to be tested for HIV. And I believe, I'm not sure, I've never looked into this, I think it's a pretty inexpensive test. So you can get it done in most clinics, most doctor's offices, big ass Doctors for Life. Most doctors will do it for a pretty inexpensive fee. I think most insurances will cover it. So the bottom line is, if you're having sex, you should be tested. If you have a blood transfusion, you should be tested. If you've had a tattoo recently and you're unsure if the needle is sanitary, you should be tested. Also, anytime you come in contact with somebody's body fluids, which is gross, obviously that's disgusting, but anytime like that, you should be tested for HIV and other types of blood-borne illnesses, like hepatitis, B and C. So that's really the bottom line. Really, the only people who should not be tested for HIV on a regular basis, are people who are really not engaging in sex, period. So, big ass cigar for life, bye.